Hey guys, Marcus.
The views expressed are not those of local community broadcasting, WYML LP, or its management, volunteers, or underwriters.
Really help the channel. I appreciate it.
Welcome back to the Personal Safety Show. This is Marcus Melnick from Firearm Mentor and Stress to Logic, your host. And we were continuing the conversation with Our House with Ambrosia and Terry. Here we go. Ambrosia, do a deep dive into the other services that are offered?
The Circle of Care, really what we're aiming to do on our 1 year is build this network of grief and substance use disorder resources for children, teens, and families who are experiencing grief and loss related to substance use related death and disorders. I said we're only a 1 year project, so we were awarded a bunch of money in this 1 year to do all of this great work. And in our 1 year, we have like 4.5 components to our project. So the first, we're going to be doing a grief support services directory. We have a wonderful researcher on our team, and what we've tasked her with is doing 2 phases of data analysis for us. With the first phase, what we have her looking at is what is the number of licensed clinical professionals that we have in the state of Illinois who advertise they specialize in treating child and youth grief. So she was able to finish up that data analysis for us at the end of August, I think it was. And so what she was able to find from that first phase of analysis is that in the state of Illinois, we have approximately 243 licensed professionals that advertise they specialize in treating in child and youth grief. And so I always like to specify to people how we got this data and this information. So basically, we got a number of licensed professionals by looking up billing codes. So looking up who was specifically billing for grief support services. We also looked at, out of these professionals, what their licensures were. So essentially, if they were like LCPCs, LCSWs, and then also looking at what evidence-based practice were they providing in their service specifically for children, teens, and youth. And so that's how we came up with the number 243. What she was able to find from this very first phase of analysis is that approximately 1 out of every 2 clinical licensed professional who's advertising they're treating or specializing in child and youth grief, 1 out of every 2 of them are located in Region 1, which is Cook County. Mm-hmm. So the other half of our licensed professionals being scattered across the rest of the state. Essentially, with our grief support services directory, we are listing all of these licensed clinical professionals who are advertising they're treating and specializing child and youth grief on the directory. So people can find the directory on the Illinois Family Resource Center website if they would like to go and view it. It's illinoisfamilyresources.org, and they click on the little Circle of Care tab. So that's how they can find our directory. But also right now, what we're working on is adding to our directory our non-clinical grief resources and supports that we have in the state of Illinois. So essentially, we're looking at, in all of our 102 counties, seeing if we have faith-based organizations who are doing grief support groups, or if we have a hospital that's putting on a grief support group, or a hospice agency that does some type of grief support for kiddos or families. Looking at, I know in our Region 1 area, so specifically Cook County, we have a lot of different agencies that host bereavement camps for children. So basically, with our directory, we're wanting it to be very comprehensive of all of the clinical and non-clinical grief resources that we have in the state of Illinois. So that's just kind of the first component of our project. The second component is we are developing some online resource toolkits. So these are going to be groups of resources and activities that will be gathered into these online toolkits, and they will be made based on the developmental age of the child. So essentially, we have 3 areas, I would say, of toolkits. They're going to be based on the age of the child. So we have resources and activities for ages 0 to 5, ages 6 to 12, and then ages 3 to 17/18. And essentially, these are going to be for our natural helpers to use. So people that are naturally interacting with kids, we want them to be able to use these toolkits whenever they're working with children who may have experienced grief related to substance use disorder. So, inside of these toolkits, they may have activities for them to do with the kiddos, maybe coloring pages for them to print off and do. Maybe there's going to be a video for them to watch. So essentially just tools for our helpers to be able to use with kiddos who have experienced grief related to substance use, grief and loss related to substance use. And then kind of the third component that we have to our project is we're going to be doing some grief and substance use disorder trainings. So we're going to be doing the Threads of Hope training, weaving support for children grieving a substance use related death. So with our project, we're doing these wonderful trainings. We have a wonderful consultant. She is very well versed in the grief and substance use disorder field, and specifically how that relates to children. So her name is Jessica Porte. She's been in the nonprofit sector working with grief and substance use disorder for the past 14 years. She's on the National Alliance for Children's Grief. She has her own consulting company where she provides grief education. And so she's doing, again, the Threads of Hope training, weaving support for children grieving a substance use related death. And really what this training is all about is equipping our natural helpers, first responders, community members, professionals, even parents and caregivers. We want to equip them to understand grief as it relates to losing someone to substance use. We want to be able to equip them with tools to foster healing and resilience in youth who are grieving. And we want to teach them strategies to help families navigate stigma that creates barriers to support. So with our trainings, we're doing 5 completely free, completely virtual trainings in total. They're 2 days each. And so we're breaking them up by region, essentially. So like region 1, which is Cook County's training, is going to be January 21st and 22nd. So the trainings are 2 days each, 6 hours each day, so pretty intense, but we have applied to offer CEUs for the training. So we're really hoping to bring a lot of people throughout the whole state to the training. If people are interested in looking at the dates for the trainings, they can visit the Illinois Family Resource Center website, which is, again, illinoisfamilyresources.org. They can look up our Facebook page, which I believe is Illinois Family Resource Center. Yes, Illinois Family Resource Center. Again, the Circle of Care falls underneath the umbrella of the Illinois Family Resource Center, and it's because of the great work that the coordinator Nancy Phillips has done in the field, which is why our project really came to be. So our project just falls underneath their umbrella. With the training, they're completely free, again, completely virtual. We want everyone in a community to be able to attend these trainings, just because you never know whenever a child will see you as a trusted adult and want to come up and tell you potentially about what's going on at home. You just never know. Anything that I missed on the training specifically, Terry?
They do not have to take it in their region if the date is not good for them. And if something happens and they miss the second day, they can take the second day in another region also.
And so kind of our little half component that we have with our project is that with our Threads of Hope training, we are going to be giving out comfort bags for kids. So in our 1 year, we're going to be giving out 14,400 comfort bags for kids. And so these bags are split up by English and Spanish bags and youth and teen bags. And so the bags have a variation of items based on if they're English or Spanish or youth or teen bags. But in every single bag, we have a Mimble ball. Mimble balls, I had no idea what they were before our project, but we were actually able to connect with the creator out in California. Her name is Julia, and her and her son created the Mimble ball, and it's like a little stuffed plush ball. It has eyes on it. It doesn't have a mouth, and it has some crazy, wild, cute hair. And Mimble balls are used a lot in clinical practice by our licensed professionals, specifically with kiddos who are experiencing grief or experiencing neurodivergency. They're also used a lot with Alzheimer's patients. They're just super cute, cuddly. They have a lot of meanings behind them. Your Mimble ball doesn't have a mouth because it means it doesn't judge you. It has this crazy hair that you can, whenever you're feeling anxious or, just needing something tactile, you can smooth your Mimble ball's hair back and give it a little hug. And then we always like to tell people too that with your Mimble ball, if you pet its hair back and then if you bop its bottom or throw its head forward, its hair goes crazy. And that's supposed to tell kiddos it's okay to be crazy in yourself sometimes. So that our Mimble balls are in every single bag. We also have wooden hearts and markers that are in every bag, so it's an activity for kiddos to do. We also have a bookmark with Jerry Moe's The 7 C's on it. So I didn't cause it. I can't control it. I can't cure it. But I can help take care of myself by communicating my feelings, making healthy choices, and celebrating me. And then on the other side of the bookmark, it has teen helplines on there. And then the rest of the bags have variations in them, but the youth bags have some books in them, and then the teen bags have some journals in them and an activity book. And so really the items in these bags are really about the social emotional learning for kiddos. So, teaching them how they can work on their feelings and their emotions, and teaching them how to navigate those feelings and emotions through whatever stressful or traumatic experience it is that they may have went through. So going back to how the comfort bags relate to the trainings is we're really encouraging people to attend our Threads of Hope training, because that is where they're going to be learning different tools on how they can use these items in the bags as a tool to help kiddos navigating their grief journey or whatever stressful or traumatic experience they went through. So in order for people to get these comfort bags, we're really pushing them to or promoting for them to attend the trainings. That way they can teach the application. We can teach them the application of the materials in the bags, and then we'll give them the bags to give out to the kiddos that they serve. And then we've got one last component to our project, and then I swear, Marcus, I'll stop talking for a second. But kind of the last component to our project is the Handle with Care initiative. So this is an initiative that was actually started in West Virginia back in 2009, I believe. It is an initiative that was created to help vulnerable children through simple communication and partnerships between law enforcement and first responders, between educators and our mental health providers, and even child welfare workers. Essentially, say if a kiddo experiences some type of stressful or traumatic event at home the night before, and say if law enforcement is involved and they are at the home. Say if they've recognized, say little Timmy has went through something potentially stressful, potentially traumatic at home. Basically, if the community has this Handle with Care initiative established, what would happen is the law enforcement officer would send some type of message to the educators at little Timmy's school the next day and say, handle little Timmy with care. They wouldn't give any other context to the event that happened the night before that Timmy went through. Just handle little Timmy with care. Again, if Handle with Care is established in that community, the educators would then know, hey, little Timmy went through something the night before at home, and if he's showing up to school the next morning, falling asleep in class, acting out and having some behavioral issues, instead of them reprimanding him for that behavior, they're going to provide little Timmy with whatever additional support it is that he may need. With the Circle of Care, we're not reinventing the wheel here. We're wanting to take this Handle with Care initiative and provide trainings to people all across the state of Illinois for them to implement this initiative in their communities. If they're interested, they can reach out to Terry or myself, and we are hoping to get our trainings scheduled here in the near future. I always like to tell people with our project, we are a one-year project. We were awarded our funds on July 1st. We had all of our staff hired by July 15th, and we have been hitting the ground running ever since, very much developing and implementing. It feels like at the same exact time. And so we're working really hard in our 1 year, and we're just really excited that our house was able to be funded for this wonderful project. So I think that's the program in a nutshell.
Awesome. That was extremely thorough. I do have some follow-ups for you.
Yeah.
Does your program provide training directly to law enforcement agencies like the Sangamon County Sheriff's Office, Cook County Sheriff, Chicago Police, or is it just like individuals from those agencies? How do you interact and advertise to the public safety community the programs that you have?
I'm so sorry, Marcus. Can you repeat that one more time? My
Absolutely.
brain just went blank there.
All good. So how do you interact with public safety in advertising your training? Are there do you work with the entire Sangamon County Sheriff's Office, Chicago Police Department, Chicago Fire Department? And I say Chicago because it rolls off my tongue. So do you provide training for entire departments, or is it just like, hey, have your substance abuse people come to our training? That's my question.
Yeah, so in regards to the Threads of Hope training or all the above, all of the above. So really, in terms of outreach for the Circle of Care, we have, certain sectors that we're trying to hit. So, we're trying to hit our education sector, our healthcare and first responders, which law enforcement fits into, our youth serving agencies. So that could be, our local YMCAs or, the RECs or other youth serving agencies, our faith-based organizations, our social service agencies, families and communities, and then our treatment agencies or recovery community organizations. And so we really have been targeting our outreach for those specific sectors. And so whenever we reach out to these people, we're saying, it's really important for everyone to be able to attend these trainings. Just because, like I said, again, everyone knows a kid. They were once a kid themselves, and you just never know whenever a kiddo will come up to you and see you as a trusted adult and want to tell you about what's going on, and that grief or loss that they may be experiencing. And so we, with our outreach, we, again, are trying to hit all of those different sectors. We have been very, very blessed with the people that we have been reaching out to or that have reached out to us to attend the trainings and to learn more about the project. But we would love, everyone if all of the deputies or, law enforcement officers at an agency could go through the training, we would love that. If they're only able to, send one or two of their staff, we love that as well. We really would love for everyone in the whole state of Illinois to attend, but we completely understand that, some agencies just don't have that capacity to send all of their staff. If that answers your question.
It does. And do you have a pen handy? I'm about to give you some resources.
Yes, I'm ready.
Okay.
Ready.
I haven't been in law enforcement in over 10 years, so all of my contacts have since retired. I don't have any contacts, or I would put you in touch with them. But I'm going to tell you about several organizations throughout the state that I think you should contact. Number one, it's called IPAC. It stands for Illinois Police Accreditation Coalition. I believe their website is I-P as in Paul, A, C as in Charles.org. It is an organization. Any accredited police departments are a member of this. There's state police accreditation and there's national police accreditation. I actually spoke at the national conference not too long ago. Wow. These are the cream of the crop police departments that have these national voluntary standards, and training is big on one of them. So, there's no cost to the training. It's a no-brainer for them.
Yeah.
And even if it's not an officer, there are models now where they're sending a social worker and a police officer to various homes for domestic situations, and often there is a substance abuse component. So that's organization number uno. The other one is called GL, as in George Lincoln, Accreditation Coalition, GLFAM, Great Lakes Fire Accreditation Managers. It's the same organization, but it's for fire departments and paramedics.
Oh,
so,
awesome.
but wait, there's more. Two more. NIPSTA, NIPSTA, that is .org. That is the Northern Illinois Public Safety Training Academy. It's in Glenview, Illinois. They train a ton of public safety people. And then the last organization I would encourage you to reach out to is NEMERT, and it's N as in Nancy, N as in Nancy, E as in Edward, M as in Mary, R as in Robert, T as in Tom. I think it's a .org. They are a state police training organization. They're certified, accredited, approved by the state. That might be another resource for you to expand to. So,
can you send those to us in an email?
No, of course I can. But I have to write it down because I will forget doing that. So send orgs.
That would be great.
Thank you. Yes.
Sure. Yeah, I'm a little. I used to be connected. So I have a couple follow-ups for you. A lot of counties, maybe all counties, I'm not sure, now offer free Narcan. Who should have it?
Yeah, so in terms of Narcan or naloxone, And with my work that I did with the ROSC, we were super big on, promoting and distributing Narcan in our county specifically. But we encourage everyone to carry Narcan, just because you absolutely never know whenever you may come across someone that may be experiencing an opioid overdose. And so actually the Our House is a part of the DOP, which is the Drug Overdose Prevention Program. There, a lot of people throughout the state of Illinois are probably enrolled in the DOP program, but the Our House is specifically enrolled in DOP. And so in the 8 counties that they serve with their ROS councils, they're able to give out Narcan for free. And so in a lot of our counties that the Our House serves, we have Narcan display sites. And so this was a super cool thing in Edgar County, which, again, I worked in Edgar County, so a lot of times I speak to my experiences working there. But we were able to have some wonderful, wonderful partnerships with one of the it was a liquor store with like a gambling room. And so they let us put Narcan in the gambling room. With our local laundromat, we were able to put Narcan there. They were called the Prairie Press, so our local newspaper. The hospital ER, we worked with them on getting Narcan there. Our local housing authority, in both of the towns, we worked on getting Narcan there. And so I think for Edgar County specifically, I want to say, oh my gosh, I don't even want to say, because I already know I'll be wrong with the number. But with their population size, we were giving out at one point in time, or we had people taking, because people can just come up to the Narcan display site and take the Narcan. They're not having to interact with anyone, which as we know, in the recovery and substance use disorder field, there's a ton of stigma.
Right. So
that's why we wanted to do these Narcan display sites, so people could just go in discreetly, pick up their box of Narcan. We had some super amazing bookmarks and business cards that showed people the steps to administer Narcan. And then we also had a fact sheet that explained, the signs and symptoms of an opioid overdose. And then I can't remember what was on the flip side. I think it was facts about Narcan or naloxone. And so, yeah, it was just so amazing. We were able to give out, I remember one month, between all of our display sites, just the ROS, we were able to give out 100 boxes of Narcan in Little Edgar County. And it was just awesome. And there are a lot of other Narcan providers, a lot of health departments. They have a lot of grants where they give out Narcan for free. Or we had another substance use disorder treatment agency in that community specifically that was a part of the DOT program. And so, yeah, we really encourage everyone to carry Narcan, just because, again, you never know whenever you may come across someone that may be experiencing an opioid overdose. And I always I keep going on a tangent about everything that I talk about. I'm sorry, Marcus, but
okay.
Kind of the last thing I'll say about naloxone is, a lot of people think, oh, well, I don't know anyone that uses drugs, so I don't need to carry Narcan. Well, we always tell people that you never know if maybe, say there's an older adult in the household, maybe grandma that has, Alzheimer's, and she forgot that she went and took her medicine, her opioid prescription medication 3 extra times
right.
that day. Or maybe there's a kiddo in the household, and heaven forbid they got into the medicine cabinet and took the whole bottle of prescription medication. Or I always like to throw this out there to people, because I have a little puppy at home and she likes to get into absolutely everything. But Narcan is safe for dogs too, and you just never know whenever,
Interesting.
A little puppy will just scoop them right up in their mouth. So that's why we always tell people it's not just about people who are using illicit opioids. A lot of people have prescription medications in their household, and you just never know.
Very good. So I'm going to ask the question, although you already answered it. Everybody, not just everybody in public safety, everybody should carry it. And really, there's no cost to it. If your county gives it to you for free, why not? It's a little thing you throw in your pocket and you squirt it up someone's nose forcefully. At least that's my understanding of it. I've never administered it, and it's never been administered to me. Never will be, unless I take too much of my prescription medications. So I'm not a candidate really to get it. I hope, knock on wood. But the point I want to make is nobody plans on overdosing. When
Absolutely.
people use drugs, they're not thinking about, well, I might overdose on. No, they're not. So it is always an unexpected emergency event, and it is life-threatening. So I would, dovetail on what you said and encourage people to get knowledgeable on this.
Yeah, I would say, yeah, absolutely. And, if people that are listening today, if they are ever wondering, like, oh, who in my community has Narcan? I know the Ross Councils are super huge on promoting Narcan throughout all of our communities. And again, there's Ross Councils all over the state of Illinois. So people can always connect with their Ross Councils or even ask their local health departments. I know that they're really big on Narcan distribution as well. Even substance use disorder treatment agencies.
Terrific. I really want to thank you guys for taking the time to talk to our listeners and educate everyone. This is the first substance abuse type show that I've run. I think it's extremely valuable. Can you both please reshare your contact information, website, social media, and how people can get a hold of you to possibly either make a donation to the program, and I'm guessing you accept donations, or even enroll in one of the pillars that you offer?
Yeah, absolutely. I'll let you go first, Terry.
Okay, Terry Moore. My email is terim@ourhouserecovery.org. Cell is 217-254-4826. And you can look up our information is IllinoisFamilyResources.org.
Terrific. Ambrosia?
Again, my name is Ambrosia Branson, and my email is ambrosiab@ourhouserecovery.org. My cell is 217-549-8772. Just thanks again so much for having us. We love being able to, talk about the program, get the word out there, and we really appreciate the different organizations that you suggested for us to reach out to. We really appreciate that.
My pleasure. I'm here to serve. I'm from the government, and I'm here to serve. That's what you don't want to hear. But I'm a networker, and you guys were absolutely fantastic on the show. Thank you for appearing.
Yes, thank you.
We have monthly concealed carry license CCL classes in the northwest suburbs of Chicago. Dates can be seen at firearmmentor.com/classes. If you have a question, we can be reached at www.firearmmentorcard.com. That is our electronic business card, has all of our contact information and links in it. It's the easiest way to get a hold of us. Until next time, stay safe out there, and I'll see you at the shooting range. This is Marcus Melnick from Firearm Mentor signing off. The views expressed are not those of local community broadcasting, WYML LP, or its management, volunteers, or underwriters.